Male infertility, that's the topic of today's video. Infertility is often thought of as a women's issue. But did you know that male infertility accounts for about 40 to 50% of all infertility cases? In this video, we will give insight into the causes, symptoms, tests, and treatments of male infertility. If you're new here, make sure to hit that subscribe button to stay updated with our latest videos. Now let's get into it. First, let's talk about the symptoms. Male infertility can often be silent, meaning there might not be any obvious signs other than the inability to conceive a child. However, there are some symptoms that can indicate potential issues, meaning that these symptoms do not indicate that you are infertile, but they can be an indication, and it's best to contact a health professional. The first symptom is problems with sexual function. This can include difficulties with ejaculation, reduced sexual desire, or issues maintaining an erection, also known as erectile dysfunction. The second symptom of male infertility is pain, swelling, or lumps in the testicle area. These can be signs of an underlying health issue affecting fertility. Thirdly, respiratory infections. Some genetic conditions that affect fertility can also affect the respiratory system. The fourth symptom is decreased facial or body hair. This can indicate hormonal imbalances which can impact fertility. And lastly, abnormal breast growth, known as gynecomastia. Hormonal issues can lead to breast growth in men, which can also be linked to fertility problems. If you're experiencing any of these symptoms, it's important to talk to a healthcare provider. Now let's move on to the causes of male infertility. However, it is possible that you are not experiencing any symptoms. If you are trying to conceive with your partner without any success, it's wisely to run some tests. There are several factors that can contribute to male infertility. These can be broadly categorized into medical, environmental, and lifestyle causes. Let's talk about the medical causes. The first medical cause of male infertility is varicocele. This is the swelling of the veins that drain the testicle, which can lead to reduced sperm quality. Secondly, infections. Certain infections can interfere with sperm production or health, or cause scarring that blocks the passage of sperm. The third cause can be linked to ejaculation issues. Retrograde ejaculation occurs when semen enters the bladder instead of exiting through the penis. It is also possible that antibodies attack sperm. Sometimes, the immune system mistakenly identifies sperm as harmful invaders and tries to eliminate them. Male infertility can also be caused by a tumor. Cancers and non-malignant tumors can affect the male reproductive organs directly. The sixth cause is hormone imbalance. The hypothalamus, pituitary, and testicles produce hormones that are necessary for creating sperm. Changes in these hormones can impact fertility. Also, chromosome defects can have an impact on male infertility. Let's move on to environmental causes. A common cause of temporarily male infertility is fever or sickness. If you are having a fever, this can impact your sperm temporarily. This can also happen when you go to the sauna or spa and your body temperature rises. Also, vaccinations can cause a fever and impact your sperm. Fever will impact sperm for around 3 months. This is the length of the cycle of a sperm cell. Also, radiation or X-rays can impact sperm. Exposure to radiation can reduce sperm production. High doses of radiation can permanently reduce sperm production. And lastly, industrial chemicals should be avoided. Prolonged exposure to certain chemicals, pesticides, herbicides, and heavy metals can affect sperm production. The last causes can be linked to lifestyle. Drug use, alcohol, tobacco smoking, weight, and stress can have a major impact on sperm. Understanding these symptoms and causes is the first step towards addressing male infertility. If you or someone you know is struggling with infertility, it's important to seek medical advice. There are treatments available, and in many cases, lifestyle changes can also make a significant difference. Let's talk about male infertility tests. If you're watching this video, you're probably wondering how you can test your fertility. There are several ways of testing. If you do not want to contact your health provider just yet, you can do a home sperm test. See the link in the description below. This already gives you insight into your fertility. Do you want to run more specific tests? Contact your health provider to perform a semen analysis. This test evaluates the sperm count, motility, morphology, volume, and consistency. If the analysis shows no or a low sperm count, a biopsy can determine if sperm production is occurring within the testicles. It is also possible to run some blood tests. This involves testing hormones like testosterone, follicle-stimulating hormone, luteinizing hormone, and prolactin. Are you suspecting that it might be a genetic issue? Then you can do genetic testing on chromosomal abnormalities. It's also possible to do imaging tests. An ultrasound or MRI can help identify blockages or other structural issues in the reproductive organs. But what about treatments? When it comes to male infertility, there are several treatment options. Depending on the underlying cause, medications could be the way to treat male infertility. Medications may include hormone treatments, antibiotics, or medications for erectile dysfunction. Sometimes surgery is necessary to treat male infertility. For example, a varicocele repair, where enlarged veins in the scrotum are removed, or reversing a vasectomy or addressing blockages. In other cases, a treatment of male infertility can be done without actually treating you. This can be done via assisted reproductive technologies. This includes intrauterine insemination, IUI, in vitro fertilization, IVF, and intracytoplasmic sperm injection, ICSI. These treatments are all just options. Your health provider will discuss which options are best suitable for your situation. If you're trying to conceive with your partner and are not having any luck, lifestyle changes can already make such a difference. Recommended changes might include diet and exercise, avoiding smoking and excessive alcohol, reducing stress, and taking fertility supplements. You can find fertility supplements for both men and women in the description below. Hopefully this video informed you all about male infertility. If you still have questions, it is wise to contact your health provider. Do you want to see more videos on infertility? Make sure to subscribe.